Hello, I'm Dr. Nikki C Mehta. Today we'll be reviewing 12 popular beliefs regarding newborn care and whether they carry any medical significance. Actually not. The first cry of a baby is always a dream come true for any new couple. But the sleepless nights which follow because of the persistent crying can be not less than a nightmare. A baby may cry because of n number of reasons. Hunger is definitely one of them. They might have passed stool or urine, they have wet themselves, they need to be cleaned, or they just need to be held because they also need to be entertained. A human touch is very important for them. Actually not. The baby needs its own freedom. It needs the freedom to move his hands and legs. The requirement for tying the baby, you can judge according to your level of comfort. If you're feeling hot, the baby will definitely feel hot, especially in our environmental conditions. It's not exactly a good idea to keep the baby wrapped up too much. If it's cold outside, if it's cold within the room, then definitely yes, but not always. So breastfeeding is the best gift a mother can give to her child. It should be ideally continued, exclusive breastfeeding till 6 months, and then later on as long as the mother is able to. But there are certain beliefs which I commonly encounter in day-to-day practice, like feeding from both sides at one go. Human milk has two types, foam milk and hind milk. For the baby to get both the types of milk, emptying one breast at one go is very important. So you have to breastfeed from one side at one time and then the next time offer the other breast. There are a few mothers who I see in my practice who because of some medical conditions are not able to breastfeed their child, and they have that guilt that I can't breastfeed my baby. So don't worry, formula milk is almost equal to the mother's milk, and your child can be easily given formula milk till whenever you wish to. Try and avoid giving other animal milks as far as possible, because the child's growth is the maximum in 2 years, be it the weight wise or the brain development. A child doubles his birth weight by 5 months, triples in a year and quadruples in 2 years. Also the brain development is the maximum in the first 2 years of life. So the mother's milk is best suited to fuel this growth, and the formula milk has been designed to be as close to the mother's milk. So ideally your comfort is the paramount. If the mother is not comfortable, she won't be able to take care of her child to her optimum level. So if you are tired, one of formula milk is absolutely safe. Actually no. Again, this is a very common question asked by mothers, especially during the summers. Basically, the WHO recommends exclusive breastfeeding for the first 6 months of life. Human milk itself has 70 to 80% of water. So no need to give extra water to the babies. You can do that once the weaning process has been started, but not before the 6 months ideally. Not really. On the contrary, you should be more worried about the urine output of the child. A child may poop 10 to 15 times in a day or once in 3 to 4 days. That is absolutely fine. But the child has to pass urine minimum 6 times in a day. That indicates the hydration status of the child. That means the child has been fed properly. Actually, it's not advisable. People do this because of the colicky pain which the babies have. But for this, burping a child after every feed is very important. You should hold the baby like this and burp the child properly for at least 10 to 15 minutes. Sometimes you may hear a burp immediately, but don't place the child down. Continue burping at least for 10 to 15 minutes. Sometimes it may happen that if you, despite doing for 15 minutes, you may not hear a burp, but it's more than enough. If you do this, giving all such medicines won't be required at all. It's not recommended. The cord stump dries off and falls within 7 to 14 days of life. It's more important to keep it as dry as possible. Also, you have to be aware that there is no infection around the stump. For this, you have to watch out for any redness or inflammation around the stump or any discharge of yellowish discharge like pus coming out from it. If that happens, you have to go and see your doctor immediately. Oil massage. Most of the pediatricians will be seeing these cases daily in their OPDs. The Indian society is much obsessed with massaging the baby, and we hire people for doing this. So hiring the people is not at all recommended. First of all, you don't know what illnesses they carry. Second, some of the techniques are wrong, due to which I have seen some horrible cases, but you can do it yourself. Just take some oil on your palm, rub it around on the baby's body, and just do some gentle exercises with your child. This helps you bond with your child better. When a father comes back from work, if he does the same with the child, that is his time with his child. So coming to the bathing part of it, it's not mandatory to bathe your child daily. The alternative can be giving a sponge bath to your child, especially covering the areas where dirt can get accumulated, like the armpits, the thigh folds, the groin areas. Just clean them off with a sponge bath. That's it. Most doctors would recommend against doing so, only for the reason that there's something known as sudden infant death syndrome, SIDS, which happens when the child's nose gets accidentally buried in the cushion and the child is not able to breathe properly. So it's ideally not recommended to do so. What I would recommend as a good sleeping practice is to make your child as comfortable as possible. A mother or a father can place the child on the chest with the face turned to one side and slowly, gently rock and pat the child back to sleep. So once the child is asleep, make sure that you put them on their back in the bed and with some cushions by the side. So there's one more thing which I notice in my day-to-day practice is that many mothers come to me and complain that the child cries a lot in the night and they have to get up and feed the child frequently during the night. Basically, you need to understand that there has to be a gap of 2 to 3 years at least between two feeds. A child, as I told you, cries for many reasons. One reason during the night time is there's a darkness, there is calmness around him. So when he gets up, he doesn't hear anybody, doesn't see anybody, and they get anxious and they cry. When you latch the child onto a breast, they'll suck to self-soothe themselves and go back to sleep. So they don't feed because of hunger, they feed because of anxiousness. So the things which you can do is, one, keep some dim light on in your room. So when he gets up, he sees something, he feels a bit secured. Second, record something in your voice and let it play by his bedside. So when he hears it, he's like, there's a human being besides me, you can pat him back to sleep. A newborn's head is usually warmer than the rest of the body. Never go by the feel of your hand. Always use a thermometer and place it in the armpit and record a temperature. If the temperature is more than 99, then there are two reasons which are common but normal in a baby. First of all is the baby has not been fed properly. That leads to dehydration, which in turn leads to fever. Second, the baby has been overwrapped. That can also cause the baby to be warm. So in such cases, open the baby, make sure that the baby has been fed well. Despite doing all this, if the baby is still febrile, then the baby needs a medical attention. See, there are many things with a newborn baby which are normal, but the parents perceive them to be abnormal or problematic. First of all, sneezing. Sneezing in a newborn baby is normal. A newborn baby may sneeze 10 to 15 times in a day, so it doesn't need any medical attention. Second, baby may cough 3-4 times a day, like it's again a normal thing with a newborn. If the sneezing and the coughing is hindering the baby to feed properly, then only medicate. Otherwise, medications are not recommended. Also, there are many skin lesions which are normal in a newborn baby. Like you may see there are white dots on the nose, or sometimes there may be rashes which erupt on their body surfaces, which usually happens after the first week of life. But these are usually normal. They go on its own. At the most, you can just moisturize the skin. There's nothing much else needed to be done. Also common in a female newborns is sometimes you may see a vaginal discharge or some spots of blood around that area. This is because of hormonal withdrawal and nothing else. It eventually goes off. Having said all that, I can understand parents do get worried. So I would recommend, if you're worried or if you're concerned, you should go and see your doctor. All the babies love to be held and taken care of. So especially during the first 6 months of life, do hold them, do talk to them, do carry them. That's not going to spoil your child, be rest assured. But once the child is above 6 months of life, when they start crawling, when they start exploring the world, don't be an overprotective parent. Because if you are anxious, the child may startle and he will stop doing what he's going to do. In the meanwhile, keep a watchful eye on the child. But don't be overprotective. Hope this cleared most of your doubts. Wishing you happy parenting. Thank you.